Hello, uh, hello friends. I'm Deepsha, uh, intern at Solar Civil Hospital, and now I'm posting on PHC site. So, according to HOD sir, told to make video on two topics. So I'm making this one video for the topic of infrastructure of PHC, CHC, and civil hospital regarding. Okay. So first we talk about PHC infrastructure. So mainly there are it is basically among the 13 to 14 villages. Uh, uh, there is it is called some district. There are districts in which 2 to 3 PHC are present. बरोबर. Uh, and then in the PHC mainly the infrastructure, if we talk about the infrastructure, so there is only one general physician is present in there, right? And most among the PHC, we have usually normal, every patient are given medicines if there is not much emergencies, and minor surgeries are also done in the PHCs, and like suture taking and other which are not complicated surgeries, and sometimes deliveries are also done. There are many programs are under running through this PHC, like infant care, newborn care, neonatal care, uh, vaccination, then nutrition, and other program like we have to there are many programs according to Indian government. So some of programs are these kind of programs are running under this PHC, and there are various arrangements are done according according to program in this PHC for the village people who can't afford the that those things which are necessary for their routine life, right? So this was about all about infrastructure of PHC. Now let's talk about infrastructure of CHC in the um, in detail and fast review, right? So basically, among the 3 to 4 CHC, there is one among the 3 to 4 PHC, there is one CHC which is present for those patients who have emergency and referred from the PHC, because there is less facility in the PHC, so all emergencies are not handled in the PHC, so they are referred to CHC. Usually the that village people come who are in which the CHC is present, and all patients from the PHC are also referred to CHC. So this kind of patient come to CHC, so there will be more facility usually. So let's talk about the facilities. So what kind of facilities are present in the CHC? So mainly the first of all the who the doctors, how much doctors are present in the CHC usually. So usually there are pediatrician, gynecologist, surgeon, and the medical officers are 3 to 4 medical officers are usually present in the present in the CHC, and we usually all the patients are treated in there are separate rooms for them. For pediatrician, usual for gynec there is delivery room. For surgery there is OT which is present, minor OT is present, and their ward is also present, testing laboratory also present, Ayurvedic and homeopathic department is also present. Then there are management and audit worker are also present. pharmacy is also present in the CHC, and the medical officer here usually present for 24 hours, right? And so the CHC is running for 24 hours, and there is also arrangement of the ambulance, which is for the emergency cases which can't handle in the CHC, so they are referred to civil hospitals, right? So basically this is the infrastructure of CHC, and now we are talking about infrastructure of civil hospitals. So basically I will give example of my Solar Civil and BJ Medical for better understanding. And so basically for the infrastructure of the civil hospital, there are all the diseases are treated in the civil hospital, right? There are many facilities are present for different departments. There are many departments like ophthalmology, ENT, gynec, pedia, medicine, surgery, ortho, radio, psyche, and skin. This, the laboratory, pathology laboratories, microbiology laboratories, which are also present in the civil hospitals. And usually we are in the, when I'm talking about the Solar Civil Hospital, there are usually infrastructure is like this. Every department has a OPD, usual OPD, where the general patients are treated and examined and diagnosed, barabar. And then talking about there are each department has their separate wards, and for those departments who have fewer to do surgeries, so they have OT room, operation theatre room, which are present, right? And basically there are other facilities are also present. There is an emergency or casualty which is present for 24 hours, like CHC in every civil hospital, right? In BJ Medical, Solar Civil, Nandinagar, any civil hospital you go, there is an emergency which is present for this open for 24 hours. So anyone can get treated who have emergency or who want to get treated by we have OPD is running from 9 to 5 from Monday to Saturday. So after 5, right, or before 9, if there is any patient who wants the treatment, so he can get treated in the emergency room. So there is emergency room. Now here also the Ayurvedic and homeopathic are present. Ayurvedic homeopathic arrangement are present. Doctors are present. Pharmacy is present. And for radiology there is X-ray, CT scan, MRI, USG, ECG, and other are there is USG of heart is done, which is called audiography. It is also present. So these are under radiology. Now for the skin, there is the same OPD ward, right, and OT. For psyche, there is OPD and ward, and MRI machine, and other shock therapy machines are present. There is also a room in which all the emergency instruments are present, like ET tube. For ortho, there is POP present for the tracing material, like H2O2 and betadine, and there is sutures which are taken in the surgery. So these all are present in one room. For it is the emergency stop which can be used for the emergency. And there is also RMO office and RMO office plus superintendent office, which is controlling all the audit and expenditure and instrument delivery, then donation from government and other NGOs. These all are collected by these offices, and all the management of the hospital is done by superintendent office. So, and there is also a parking. There is a good parking arrangement is also done, and in some hospitals like BJ Medical, which is largest hospital of the Asia, there is also a little temple is also present. And basically for the food, we have arrangements of food for the breakfast, dinner, snacks for evening, and lunch. There is all arrangement are done in the civil hospital. Usually in the BJ Medical Hospital, they are providing eggs and milk with breakfast for morning. Then usually in the afternoon we have chapati, rice, vegetables, dal, which is given as a midday meal. And for the dinner they make khichdi or kati and chapati and sabji. These are usually good food are provided in the morning and evening. Some whoever needs, they also provide the tea in the morning and the evening, right? So basically these are structures which are present, which I told you just now. And now I am trying I will try to do some if anything is less in this, so suggest me, sir. And thank you, sir, for listening this my video.